Good afternoon, everyone. Thank you for coming to this session. Quick intro before we start. This is a speech about the US baby formula shortage, but everything is explained in the speech itself. And just a word of warning, it's a bit of a long speech, I think. I haven't practiced it, but it's a bit long because there's a lot to say. So maybe work on your stamina, see what you want to prioritize, and good luck. And I'll just plug in my computer if you give me a second. Okay, sorry for the last minute fix. So let me start. Good afternoon, everyone. If you follow the United States media or their news, you will surely have heard about the baby formula shortage that the country is going through at the moment. However, if you have not, don't worry, because I'll be telling you all about it in just a moment because I find it fascinating in a bad way. So what's going on? First of all, there is a shortage of baby formula in the whole of the United States, and it's as bad as 50% in some states. Obviously, parents of newborns are in a panic because they cannot find food for their babies, as if new parenthood wasn't scary enough as it is. The government is trying to fix the situation within the limitations of its own legislation, the extreme market economy of the United States, and with Republicans blaming President Biden for the baby formula shortage. They argue that Biden gave away all the baby formula to undocumented immigrants rather than to hardworking American families, which is obviously not true. And they would rather blame anyone rather than capitalism or even poor business management. So what is happening? Why is there such a shortage for baby formula? There are three reasons that I will explain in this speech. The first reason is a company called Abbott. In the last year, more or less, 4 newborn babies got bacterial infections, and 2 of them unfortunately died. It is believed that there is a link between these illnesses and deaths and some baby formula made at a Michigan plant owned by Abbott, which is one of the biggest baby formula producers in the United States. Abbott obviously denies any links or any responsibility in these illnesses and deaths, but the fact is that this bacteria, which made the babies sick, was detected 8 times in their plants between 2019 and 2021. Further inspections also showed that the factory had leaks and in general a lack of basic hygiene, so not very promising. To sum up, there was an obvious concern of contamination, and the FDA, the Food and Drug Administrations of the US government, forced Abbott to issue a recall in February 2021, and the factory closed. Why didn't it close? Sorry, in February 2022, this year, not last year. Why didn't they recall the product in 2019 if the bacteria had already been detected in their factory back then? There are several theories, the main one being business is business. Abbott did not consider this issue a priority. Baby formula and baby feed in general is just a small share of its business, which includes medical supplies and medication, for example, and they decided to prioritize their own revenue and shareholder profit rather than food safety. So that's the first reason. Abbott's factory in Michigan is no longer producing baby formula. That's the first cause of this shortage. The second cause of this shortage is the pandemic. Does it ring a bell? Do you still remember it? I'm sure you do. Unsurprisingly, there is a pandemic plotline to this story. As you will have heard, as you will remember from your own supermarket visits, there have been supply chain issues and even changes, sometimes unexpected, in demand levels. To put it very briefly and so simply that it's probably wrong, in 2020, people stockpiled on many products, right? We all remember people stockpiling on toilet paper, taking rolls and rolls of it home. Well, they also stockpiled on baby formula if they had young babies, to a point that even supermarkets had to limit the number of bottles of baby formula that a single buyer could take home. This means that there was an increase in demand and therefore an increase in production as soon as it was possible. That was 2020. In 2021, because people had stockpiled so much baby formula at home, they didn't need to buy any more. They were just using the baby formula that they had bought previously. So demand dropped and production adapted and also was lowered. That brings us to 2022. There has been a little uptick in births. There have been more babies born in the United States. However, there has been no increase in breastfeeding rates, which we will discuss later, which means there's higher demand, but it's been difficult to increase production, among other reasons, because the Abbott factory is still closed. So we have another problem contributing to this shortage, which is supply not meeting demand. Thirdly, we have structural issues relating to the US economy and their production model. 98% of all baby formula used in the United States is produced domestically in the United States. 98%. And if you remember our old friend Abbott, frenemy maybe, they make 43% of all the baby formula used in the United States, which is enormous. As we learned, hopefully, during the pandemic, it's very dangerous to rely on a single supplier for any product. We learned that with face masks. When we needed face masks, we couldn't get them because our only supplier was China, and China was not exporting any. So here, the opposite is true. Only national production, although it might seem safer because you'll always have your factories, no matter the international situation, can also be very dangerous because if domestic supply doesn't work, you're left with nothing, as is the case today. Besides, as if that wasn't enough, importing baby formula into the United States is very difficult because there are very high tariffs on imports and there are very tough technical requirements. So we have this silly situation, even in this time of shortages, which we're facing now, which is that European baby formula, which is abundant, cannot be exported to the United States. It doesn't meet all the technical requirements for imports. It does meet the nutritional requirements, so meaning that it's good enough for babies. And many people say European formula is actually better for babies than American formula because it's healthier, because, for example, it doesn't contain corn syrup, which is very unhealthy. But in spite of that, it cannot be imported because it would be very expensive and very difficult. Then there's another structural issue other than this domestic production and import issue, which is corporate concentration, meaning or a big part of the market share in the hands of very few companies. In this case, as we said just a minute ago, 98% of baby formula production is national, but 90% of that production is by 3 or 4 companies. And Abbott accounts for 43% of that production, as I said. So to sum up, virtually all baby formula in the United States is made by 3 or 4 companies. If one company has a problem, for example, Abbott, that has a huge impact on the whole market. This situation is known as corporate concentration, as I said, but it's very close to a monopoly. And a monopoly makes an industry basically immune to the invisible hand of the market. And it also makes the public extremely vulnerable to crises, such as a factory closing down. In other words, I would say it's capitalism gone wrong, but I'm guessing that many Americans would not agree with me. These are the causes and the reasons of the baby formula shortage. But what is the impact? I already said that parents are stressed. They are afraid that they will not be able to feed their little babies. And that has led them to take many different actions. They have been looking everywhere for baby formula, every supermarket in town. They've been looking online. They have organized into groups online to share whatever baby formula they had or could find. Unfortunately, some people have fallen for scams because whenever there is a problem, there's always someone trying to make a profit of it. They have taken risky steps, such as making their own baby formula, homemade baby formula, which is very dangerous because it's not something you can make at home. Some people have had to dilute the baby formula that they had, which is also dangerous because it could mean that the baby is not getting enough nutrients. There have been some breast milk banks set up so that the women who are breastfeeding can share the breast milk that they have with other families who need to feed their babies but cannot breastfeed. So all sorts of measures. And about this last one, breastfeeding, it's not as easy as just saying, oh, if there's no baby formula, just breastfeed your baby. It's actually very difficult to do that, and we'll discuss that in a minute. I have a lot of stuff to tell you before that, and I hope you're not tired yet. So the key thing here with the impact is that there's been huge disparity in how it has impacted families, this baby formula shortage. And unsurprisingly, it has hit poorest and non-white families the hardest. Some of the reasons for this are obvious. Poor families cannot afford to drive around everywhere looking for baby formula. But then there are more, let's say, like more there are reasons that are harder to accept, I would say. For example, for years, baby formula was specifically marketed to poorer and non-white communities. So it created a bigger reliance on this product. And therefore, now that there's a shortage, they have become more vulnerable. However, there are two key aspects to this unequal impact of the baby formula shortage, which are the WIC program and breastfeeding related issues. Very briefly, on the WIC program, it's a US government program which provides support for pregnant women, breastfeeding mothers, and their babies. Among other measures, they supply baby formula to these mothers for their babies. How does it work? That's the key of the issue. Each state, which is part of the WIC program, gives exclusive rights for baby formula supply to one company, one of the 3 or 4 baby formula producer companies that we have, okay? You'll remember that. So Abbott, again, Abbott was responsible for about 50% of all the babies who were getting WIC benefits. I think that's enough for you to imagine the impact that this Abbott factory closure had on the WIC program. The other issue that I wanted to mention, and I promise it's the last issue before all the solutions, is breastfeeding. Why not simply breastfeed all these babies that have been born this year, for example? After all, the World Health Organization recommends at least 6 months of breastfeeding for babies, exclusively breastfeeding without any supplements. And, there's the famous phrase, breast is best. Good luck translating that. So what is the issue? Just replace baby formula with breast milk. Easy as that? No, not really. You cannot simply switch on a breast like you open a tap. This might seem obvious, especially to any mothers in the audience, but it is clearly not obvious enough in a world where some men think that women can, for example, just hold in their period blood. So, there's a lack of education there. Besides, there are numberless, is numberless a word? I don't even know. There are many, many personal or medical reasons why breastfeeding might not be possible for some families. For example, the mother might be taking some medication, which means that she cannot breastfeed, or the baby might have medical issues, or even getting a baby to latch onto a breast and start sucking can be very difficult. But then there's my favorite aspect of all this, my favorite in a bad way again, which is socio-economic factors. It is well proven that wealthier and white mothers are more likely to breastfeed their children. In order to do that, they possibly need to take time off work, or they need to have the possibility of pumping milk for their baby around their job. So they need to have time before or after work, or they need to have a break during work. They need to have some privacy in order to do it. All these things are more likely in wealthier contexts. Besides, a key aspect here, which perhaps I should have mentioned at the very start of the speech, because it would have made things easier to understand, is that the United States is the only developed country without paid maternity leave. This means that when you stop working in order to have a baby or care for your baby, you're not being paid at your job and you don't get any benefits. This means, obviously, that the wealthier you are, the more likely you are to take a longer break after having a baby. And the poorer you are, the less likely you are to do the same. Poorer mothers, to sum up, take less time off work after having a baby, and therefore they have less time to establish a breastfeeding routine. They are also more likely to have jobs with long hours, with little support, with fewer breaks, with little privacy in order to pump, for example, or breastfeed. And besides, they are more likely to also have long hours of housework, which add to the lack of time and lack of possibility to breastfeed. There's also the aspect of historical trauma. For example, among Native American women, the breastfeeding tradition was partly lost during the years of oppression and discrimination because of forced separation of mothers and babies, and that has not been passed on to the newer generations. In Black communities, on the other hand, there is some remaining trauma from slavery times when enslaved mothers were forced to act as wet nurses for their employers, rather owners, babies rather than their own. So they would be feeding a white baby and their own baby would go hungry. So there's some historical trauma that hasn't been addressed because there's a lack of breastfeeding support as well. Specialized breastfeeding support from doctors, midwives, nurses is limited to hospitals, which are more likely to be in wealthier and whiter areas. So as you can see, it's a very complex issue with lots of layers that are very hard to address. But we cannot finish a speech without offering some solutions, right? So what can be done about this and what is being done about this baby formula shortage? In the short term, President Biden has activated the Defense Production Act, which is a wartime piece of legislation, which will allow for faster production and easier imports. There have also been emergency imports from countries such as Switzerland, who have sent baby formula to the United States. There will also be more flexibility for the WIC program, meaning that it will not rely so much on Abbott or on the other companies. And the technical requirements for production and import will be lowered, so it's easier to make baby formula and put it in the market, which we'll see if it's a good idea, but anyway. However, these short-term solutions are obviously not enough. We need long-term thinking, as with any problem. We need to think in terms of global food security, not just national or local food security. We need to fight inequality, obviously. Is there a speech where we don't mention that? We need to support mothers, babies, families, and the United States clearly needs paid maternity leave that falls within the remit of supporting mothers, and also strong antitrust policy to avoid corporate concentration, which can lead to these issues and these very difficult crises. In any case, this is all from me. We'll see how this ends. I invite you all to follow this story on the news because there will be interesting developments, no doubt. And I hope that you're not completely breathless by now.